Today is May 11th. It is a Friday. It is 2 weeks and 1 day post my revision surgery, plastic surgery, rhinoplasty for a um, a repair that was a result of a nasal reconstructive surgery, which was from a septal collapse following a double jaw advancement surgery in March of 2017. So I had, during extubation, my septum was collapsed. It went sideways. So in September of this past year, they did a rib graft and basically rebuilt the inside of my nose because I already had one septoplasty. It involved a rib graft. It involved fracturing the bone and rebuilding the inside of my nose. And as it healed, and the rib started to sort of reshape, warp a little bit. It was pulling away from my skull here. Now it's connected, which is good. And it got deviated pretty much to the left. It was very crooked. So I had a revision surgery 2 weeks ago, and basically it was mostly cosmetic. There was a blockage on the left side of my airway, so they did remove some scar tissue and straighten the inside a little bit, but mostly it was on the outside. They took a big incision out of the side of my head and took some fascia from my scalp to hold everything back in place, and they sewed it back in. So I'm 2 weeks after. My surgeon said it'll be about a year till all of the inflammation is gone. It's actually much closer to pre-jaw surgery appearance, although a little bit bigger. It's definitely better than the first surgery because that was such a complicated mess that I'm feeling at least okay about it. I still have issues with my lip. Hopefully now, once the inflammation goes down a little bit and the nose becomes pliable again, I'll get re-control of the muscle. There's a scarring in here because my lip had incisions twice underneath, once to put the plates in, and then during the first nose procedure, they removed 2 plates and 10 screws because of the proximity to my sinuses. So my upper lip is kind of a mess, and the muscles had to get reconditioned because my whole facial structure has been changed with the jaw advancement. So I would say that I look much closer to pre-pictures than I have in a year. So I'm happy about that. But the progress of the post-complication has been longer than I had hoped for sure. But I'm hopeful now that we're kind of out of the woods and I'm in good shape. Again, the lip and the upper teeth, that's something that is different. I still have a little bit of a lisp because of it. I think there are some things you can do in the muscle to kind of raise it up. I'm not sure if I'm going to do that or not. It depends on what happens if I can recondition the muscles myself. And again, once the swelling in the nose goes down a bit and it becomes more pliable, because right now it's still a rock hard. The difference this time is I can't feel my nose. After the last surgery, I could still feel everything. Now I can't feel that at all. It's weird. It's kind of, I could feel a little bit here, but here, nothing. Zip. It's weird. But it is what it is. So anyway, that's an update for the post-surgical. Finally, all of the stitches are out. I picked a couple. There were a couple of dissolvable ones that were kind of sticking. I just yanked them out because they came right out. It was just, they kind of fell out really. And then the splint rather, came off today. So I am on to recovery. I have to still wait another 2 to 3 weeks before I can exercise and elevate my heart rate, because we don't want to entice bleeding and or inflammation from just elevated heart rate, so or any kind of exertion. So I have been really trying hard to sit still, which is difficult for me, but so far so good. And hopefully there will not be too many more updates on this front. Once the nose inflammation goes down and my lip and teeth and mouth seem to settle in, I may do another kind of post-surgical, like 18-month update or something, but I don't really know. But for those that have emailed me, or responded to me because you're going through similar things, keep it up. Happy to share my story and my experience. I will just say anyone that's getting double jaw advancement surgery, just to really understand the potential risks, make sure you talk to the surgeons, especially if you've had nose issues in the past, like I did, to ensure that they don't jack up something that was already fixed once. So officially had a broken nose, deviated septum, had it repaired, had a double jaw advancement surgery where I had a septal collapse, nasal deformity, saddle nose, all that. nasal reconstruction with rib graft, and now finally revision surgery. So 4th major surgery on my nose, and hopefully the last. So again, thanks for tuning in, and good luck to all of you who are having this kind of surgery. Hopefully that you all sleep better and have a better quality of life because you have more energy during the day. Thanks a lot again, and I'll talk soon. See you.